Okay, we need to start with the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, I will entertain a motion to call this meeting to order. Okay. Do we have the minutes from the last meeting? Are these deadlines?
Yeah, the HFI ones, yes. And there was a couple of typos we pointed out, and I will get those straightened out tomorrow, actually Monday. And if you guys want new copies, I can send them to you. If not, we'll just not worry about it. I'll just change it and put in the book.
All right, thank you. I saw one of the typos. I'm gonna tell her you said that. All right, if there are no other concerns with the minutes from the last meeting, I'll entertain a motion to approve the minutes from the last meeting. I'll make that motion. Is there a second?
Second.
Okay. We want to welcome our new health board member, Nick DeVilly. Why don't you tell us a little bit about yourself, sir?
Oh, thank you. I'm Nick DeVilly. I'm a longtime resident of Perry County. I saw this actually on one of the commissioners' meetings and was looking for a way to get involved. I've worked in correctional healthcare for the better part of 10 years as an administrator, so I know a little bit about healthcare, but not quite on the free world. So I'm used to working within government systems. So.
Very nice to meet you. Welcome to the board. Thank you.
Welcome.
All right. The next item on the agenda is organizing the board for this calendar year for 2026. And I am grateful to give up this role. So I would happily nominate Nick to take over as president of the Health Department Board. And I was so moved. So are you seriously declining the nomination?
At this time, yes.
It's like, this is my first meeting.
That's why we can't keep members on the board. Welcome to the board, you're president.
Okay. Isla, Corey, will one of you please step up?
Isla declines.
Looks like it's you, Corey Philly.
What did you do to you last time?
I think that's how I got
Yes.
Okay, well, the nomination stands at Corey Philly.
Thanks.
Okay. I'll make a motion to approve Corey Philly as being the new president of the health board. Can I get a second? All right.
Effective immediately or next meet or tomorrow?
Tomorrow.
Okay.
I'm not that bad. I'm not that bad. Okay. We have some HFI dollars that we needed to develop a more detailed plan to address how we're going to spend to meet our core services. And our health department team has come up with some ideas as to how they would like to do that. And they're going to walk through some of those things with us this evening so that we can ask some questions. So I'll hand it off to you all. Mallory, Amanda, Donnell. How do you?
We'll let Amanda take it.
Take it away.
doing?
Well, sorry, this was, just like a help for our key performance outcomes. And we were just filling this in, like a chronic disease prevention, in our partnerships and our strengths, anything that we could do to improve that and what we wanted to do for the next year. So it goes through several items. I don't have it completely filled out. We kind of ran out of time, so we still have a few things to add. This is just due by the end of March to the state. One that was left kind of blank. We thought the leading cause of death kind of in Indiana and Perry County was kind of heart disease. And then for injuries and accidents, it was preventable accidents and car or vehicle accidents. So. I think we all put our heads together and filled out most of it, but if there's anything that you guys want to add, or you think that any ideas on how to improve any of these items. Some kind of new exciting things. Emily George and Kaylee Cass came and met with us, and we are going to put the walking once a month back, call it Moms in Motion, and then also like a breastfeeding series. We're going to collaborate together.
Probably have anything you want to add? I think she covered it.
Yeah.
So far. Okay. Nick, do you have any specific questions about this particular? Are you familiar with this funding?
No.
It's probably not going to exist in the future, but we're trying to do the best
How
we
much is
can
left
now.
currently?
What were we awarded this last fiscal year? I don't have the exact number. Was it 190? Was it
101,
That's what I thought. It was like
Yeah.
100,000 somewhere. I think it was 101, somewhere in that neighborhood.
101, 611.
There you go. Thank you. 101, 611.
Was that our part or total part?
Total.
Total part, because sanitarian gets 25% of that, and then other 25, right?
Well,
It's 60. It's
It broke down a little different. I
this
just
year.
cut mine as much as I could. It could be 60/40,
Okay, that's right.
but I cut mine as far as I could, so.
Maybe help educate me why it's not gonna be around.
It changes in the state. So this money was appropriated and awarded to county health departments in order to advance public health initiatives.
Sure.
And the objectives as far as state government is concerned have changed. So we probably will not have this type of funding going forward to advance public health. But we're already doing a lot of public health initiatives. This was meant to address specific core service areas and what and how we were going to address those specifically in each of our counties. And there's reporting that has to be done. You'll notice from the minutes, we did a budget back in December, and then we did a recap to the state by December 30th. And we had to report on all of the core services data, basically everything that we did that contributed to that metric had to be reported on by December 30th. So essentially what the staff has done is they're taking what we've done in terms of the budget, and because we had to appropriate this money into certain areas, and they're deciding what we're gonna do in each of those areas. And that's what this plan is representing, is where we are today. And it's not complete, but they have to get it complete and submitted to the state by the 30th, right, of March.
Yeah, this plan has to be turned in.
And it was significantly cut from 25 with minimal changes in service offerings.
I think 25 was like a little over 300,000.
We did carry,
And that's salaries and everything.
about 25,000 or so of the 2025 balance into 2026.
My part was more than that even, but because I had an assistant budgeted but didn't utilize it, so.
Some ingenuity on your all's part, for sure.
We hope that it stays, but it more than likely will go away.
We do the best we can with what we've got.
I would encourage you to go out to the state website, the IDOH website, and look at Perry County. All of the reporting that this group has done is on that website, so you can actually see every single solitary thing that they've done and how they tied it to a particular core service. So we should see improvements in public health as a consequence, or we should see improved awareness depending on what we're trying to accomplish. Sometimes we're just trying to improve education or improve awareness. Sometimes we're trying to partner with another organization in order to afford people specific things that they may not be able to afford, like mammograms. Sometimes we're trying to give people car seats or cribs because we were focused on safe sleep for infants. So all of those things are documented on the IDOH website. Any other discussion about that?
No, just our three main ones that had been chosen for was infant premature rate,
Preterm birth.
preterm birth, adult obesity, and immunizations.
Any other discussion around that? Kim, you have the floor.
All right, so as I was saying, last year, there was assistant money that unfortunately we chose not to utilize because we knew that the funding would not be there in, future years. So I do have some funding, and there was a lot of discussion on what to do with it. And something that we had talked about for years was having a sign put out in the front here that we used to have that roll-up sign. You guys remember that? The one that was mobile?
The vaccines here and all that.
Yeah, and you couldn't hardly read it. It was not really user-friendly, lots of issues with it. And now I don't even know where it's at. But anyways, I talked to Scott Strobel to get an idea. Let's see where my paper is. An idea of what the cost was and if it would be doable. Pass that. If it would be doable to get something like that with the amount of money that we have. And this was just a quick thing that he came up with. It is similar in size to the one at Ohio Valley Towing. All color, it's accessible by computer. So anyone can do it inside anywhere. You don't have to be here in the building to change it. And it's also, he said, this is just one of many, like we could go with different size, different colors, different shapes. He just took the Perry County logo and stuck it on top. But that was just a very vague impression of what he could do. And I just wanted, I've talked to the immediate health department and thought that I would see what you guys thought.
You're proposing putting like in the front yard, if you want to call it that.
At the end of the drive, yeah, like, where's the driveway?
Yeah, right over there.
Right there.
Yeah.
Yeah, and he suggested this side versus the other side. He came out and looked at it, and I don't really care, but I think as far as, the purpose behind it, being able to provide education to the community, being able to provide information for all of the health department and basically all of the armory if need be, and to use it as public health awareness times. We've all got different days, and septic week is in September. Just a note, don't flush baby wipes. But lots of good stuff that we can share, and this is an opportunity for us to do that. Just have another finger with the public, because newspapers have declined. Social media is at the height, but it doesn't reach all ages. So this is something kind of in between. People drive by here a lot, and it would just be a great way to reach people.
Is the $23,000, that include installation?
So the only thing we would be responsible for is electric, is bringing the electric to it. And he said that would be very minimal. That again is just a ballpark.
Yeah.
But yeah, that was the guesstimate. And again, it can be bigger, smaller, whatever. And more elaborate, less elaborate. I mean, I don't know about the thing on top, the logo. I mean, a square, I think, is fine, whatever. But yeah, I think he was guesstimating under 1,000 for running electric.
Okay.
So, because basically it's a straight shot from the building.
Any kind of warranty or service beyond installation included?
They
in that?
do, and I didn't get specifics because I just
Sure.
wanted to throw this out here right now to see if it was an interest. But I can't remember if he said 5 years, just not for like light bulbs, of course, but for the typical maintenance is on us, but the structure and that kind of thing would be guaranteed. It was either 3 or 5 years. I can't recall, but we just had a verbal conversation quickly about it.
And they would provide tech support, I'm assuming?
Yes. Yes, to
Your
teach us
health
how.
officer can't help you if it.
We'll look to the future president.
President-elect.
Yes, the president. Thank you for that. No, he did say that they would educate us on how to utilize the program. They suggest using a laptop specifically for that, and just making it, since there's several of us, making it available. So like we could leave it up front in, one of the front offices. I'm sure Danielle, she's our most tech savvy. But yeah, he says it is very simple to use, which was good for me because I am not tech savvy. So, that helps tremendously. And again, I think that it would help us to get a lot of information out there.
Is there, you said a dedicated laptop. Do we already have that, or is that something?
We do.
Okay.
Yes.
What core service and what justification are we going to be able to provide IDOH?
Education.
Education.
Yes, and I could specifically do that for me, because I tend to not use social media, but I think it could be used on all of our core services on education.
I'm glad that you have thought through the core service and you decided how you're going to do the justification analysis. It makes sense to me. Anybody else?
You know, if it meets the KPIs and, I mean, it's the sanitarian fund, so if you have nothing else that you'd rather feel that you need more.
Well, I feel like this is a great opportunity to do something for the entire health department and the community. You know, that it is long lasting and gives us a lot of bang for our buck.
Just don't cause any traffic accidents.
Nothing like that showing up there.
Anything else, Kim?
Well, I'm not going to talk long, but I could. I have recently been at a couple of conferences, and I just wanted to bring back some of my takeaways. One thing that I am really happy and proud of are these. They are called HIT kits. And Nick, I don't know if you know what the sanitarian does, but I'm responsible for septic installation and permits, food inspections and permits, environmental concerns, dog bites, tattoos, swimming pools, eyelashes, that kind of stuff. So, but this is concerning septic, and it is very common for somebody to dig and to hit something, whether it be electric, water, sewer, so anything like that. These are free kits that are available through 811 that I ordered for all my installers. So each one of my installers gets one of these bags. Didn't cost us a dime, and they'll be able to locate and mark if they do hit, when they hit something. So it is very helpful to utility companies and to the installers that work in our community as well. So I was real excited about
That
this.
is awesome.
Yeah, it's a great
That's
thing.
free.
Yeah, it was
That's better. It's my favorite word.
Right? I was like, seriously? Yeah, great. Lots of great other information, though. It's an exhausting couple of weeks, but I went through 3 different conferences. The WET show, which is wastewater, and that is a nationwide conference and very extremely tiring because there's so much information. But it brought a lot of great things. I always feel like if I can bring something home that I can actually utilize, that it's worth the time that I've spent. Probably, you know, I guess there's a lot of things that I can tell you about, but for time's sake, using technology for SOPs, that was amazing to me. I'm not a video person. I don't like my picture taken. But to know that if I make a short video showing somebody how to do something, then I can just show it to them after I teach them so they can get that continued education. I'm all for it. I was just blown away. And don't ask me why I think that's revolutionary, but I really do. Have you guys seen that happen? Do you use that? You do use those skills?
We use
Yes.
AI Scribe in the workplace.
Yeah.
No kidding. Well, I was amazed. I was just, I'm behind the times, I guess. I'm not tech savvy, but I loved it. So I was going to share. And I think we could also use that here. And I know we don't use that here. I also went to the IOPA conference, which is Indiana Wastewater Professionals. I was able to receive 2 certifications that I did not have for installation. So in order for me to inspect a system, I have to be certified. And this technology changes constantly. And one of the companies is Sledgehammer, and they offered this again for free training. So I was able to get certified in that. So now if I have an installer that wants to bring that product in, I can actually inspect it. So that's great. to have that out of the way without having to do it if it happens. I was also certified in the ATL certification, which was updated last year, and Elgin, which I already had, but I went ahead and sat through just for a refresher. This is something, tiny homes. I don't know how much you guys have heard about tiny homes, but that's a big deal in the septic world, because how do you size it? You know, this has never been anything addressed. It's not been in our rule before. And now they are addressing that and actually putting a definition on what a tiny house is, how many people can sleep in it, how many square foot it needs to be, and you know, what that means to me in sizing it, the system for it. So that was helpful. And the last thing I want to talk about, so keeping it short, we'll pass these around. There have been a lot of establishments having issues with people bringing animals into businesses. So I don't know if y'all have seen on Facebook, but the latest was an animal peed on a product in a store.
I saw that.
And, you know, it's difficult because, you know, I get it. In the summertime, you know, people are like, oh, it's hot. I don't want to leave my animal out in the hot car. That's great. I do get that. But at the same time, if there's food served, you know, there's rules and regulations, and we all have to follow them. So what is a service dog? Because everyone is scared to say, oh, you can't have that in here, but they want to complain about it on Facebook. And I can't be everywhere all the time. So if you're just saying it on Facebook, I may or may not see it. And at that time, it's probably too late to do anything about it. So I did make this brochure of what a service dog actually is. And an emotional support dog is different than a service dog. A service animal is just that, a dog. It is only a dog. It can be any breed, any size, with one exception, and that's a miniature horse. You can have a miniature horse. So if you see any other animals in Walmart, they're not service animals. We've had a snake in there before, and in Nobles, claiming that it was a service animal. But like I said, as far as Indiana and the ADA is concerned, that's not a service animal. I guess the biggest point for this is trying to get people to understand that if you see something, please call us. You know, I can't do anything 2 days later. So timing is kind of urgent at that point. And not that it's like, oh my gosh, that dog is out of control and is going to hurt somebody. They'll call me then. It's when it's just, well, there's a dog eating in McDonald's and sitting at the table, and we're like, well, it might be a service dog, and because of liability reasons, we're not going to ask. There are 2 legal questions you can ask. Is it a service animal, and what task does that animal provide for you? If they don't have a good answer for that, then an animal doesn't need to be in a retail food establishment.
They don't have to have papers. any kind?
They do not have to have papers. And they just have to answer your question. And it has to be an answer that is, if they say, well, it keeps me calm, that's not a medical reason. If it can prevent or, you know, even tell you that something's gonna happen, then that's different. That's a medical reason. Otherwise, you know, they're just not allowed in retail food establishments, which would include most grocery stores nowadays.
Corey, you can't take your emotional support chicken into Walmart.
What am I supposed to do with it?
All these chickens are running across the road and getting hit.
That's okay.
We're not gonna have any chickens left.
I guess we know the chicken crossed the road for a reason. Okay. Any additional comments, Donna?
Yes, one for sure. I just got recertified as car seat tech.
Perfect.
And as far as I know, I think I'm the only one in Perry County. There might be one other, I'm not for sure if he got his recertification in time. So I did do that, was last week or the week after.
Might have been the week
It
after.
might have been the week before that, so.
So we get Kim signed and we can let everybody know they can get their cars.
Yes, yes.
I'll bring you business.
Mhm, sounds good to me. Because I had a lady come in and both her car seats were installed improperly.
Mm.
So I was out there for like about 40 minutes.
Was it cold that day?
No, they kicked my fanny, let me tell you. Both those car seats kicked my fanny. I'm like, I was all up in that car, pulling, like, it was rough.
Yeah.
It was rough.
Yeah, it always helps me to just put my knee in it.
Well, I had my knee, actually I had my whole body sitting in one of them, just so I could get some pressure and pull it tight. So, yeah, it was comical to watch.
I wish I was here that day.
I'm glad nobody videoed it.
I was gonna say,
Really,
that's a great opportunity for that. Record it now. Yes. If you want to know how to install a car seat.
Oh, sorry, Donna, you have something else?
And just, the other thing was the emergency preparedness grant that's coming up. I wanted to talk about that too,
Okay.
so.
I forgot you wanted to talk about that.
Yeah. Cause
I will be leaving in June.
yes, Tara will be leaving. And so that's gonna leave that position open. And I was, hoping to take that position on with my other duties, but only if compensation came with it. Because I was the emergency coordinator when I first started for 3 years. When H1N1 was going on, I was in charge then. So, and I absolutely love doing it.
And she does a
Love
good job at it.
Doing it. So, but I just wanted to throw that out there so you guys can think about it. If it's something that you guys would back me on, or if you guys are wanting to go in a different direction with it, but I would appreciate that duties tagged on to what I'm doing now. So, but we can discuss it more later once I get all the breakdown on what's coming, how much money it is and stuff, so.
In the interim, would you mind going ahead and giving us both job descriptions? I know I'm not as familiar with that role and Nick is brand new. That probably would be helpful to know.
I can do that.
And would this be something that would need to go to the council to,
Yes, because if I ask for money for compensation, the council will have to say, yes, you can have the money, which will be coming from the grant.
okay,
So right now the grant's 20,000. Of course, I'm not asking for the full 20,000 by no means, but what's left over, say if I ask I say I'd like to have 5,000 just to do it. The extra we usually put towards supplies or equipment that needs for the health department. That's what we've done in the past too. But my main thing, I just wanted to put the bug in your ear and then I can talk with the rest of the girls and we can kind of break it down and see if it's actually possible. But like I said, I would love to have the opportunity because I love doing it. Cameron and I have been working
And
the
she's very good.
last couple of, probably about the last 3 weeks on updating all the plans
We've
and
got all
getting,
the plans pretty well,
Mhm.
close to being all done.
got close to being all done, so.
Awesome. Mallory?
I don't have anything right now, but I sooner or later will.
as many of you know, vaccines has kind of been a little bit of a hot topic with new schedules coming out. There's going to be a schedule by CDC, and there's also going to be a schedule by the American Academy of Pediatrics. So whenever CDC puts their schedule out, I'm going to bring it to you guys and basically ask, which one do you want me to use? I have a recommendation, but
I think I know that recommendation.
yes.
Sure, I would also
But
make that recommendation.
my immunization guy at the state level was like, you have to tell your health board. So I was like, yes, I will do that. But they haven't released it officially yet. So whenever that comes out, I will talk to you guys about it. That's it. That's all that I have.
Pam?
I'm good, just that I'm leaving in June. We've been working together, getting all the plans updated, and if, I think she does a good job, be a good fit, And I've had a good time doing it, but I'm ready to retire.
She's selling it awful hard there. Anna.
The funny thing is, she thinks she's leaving. She's actually
Yeah, she likes that.
I told her I'd still volunteer, I'll help them do whatever I can.
That's wonderful. What about you, Patty?
Good.
Amanda?
I'm good, thank you.
Board? Anything?
I don't know, I mean, since this is a public meeting, Amanda has not been introduced to the county, so. it's-
Why don't you introduce yourself?
I am Amanda Hinton. I've been a nurse since 2010. I've been a part of the health department since January of this year. Still taking everything in, but grateful and thankful for this opportunity.
Well, if there is nothing else under miscellaneous, I will entertain a motion to adjourn the meeting.
What's our schedule like for next meeting?
We usually do every 6 months unless there's something that comes up and then we need to meet in the interim, but that's your call now, not mine.
I'd say tomorrow.
I didn't know if it was 6 months from now or if this was added on. That's still 6 months.
We had to have an organizational meeting. We could not
Because it
do
makes
that
more
till we had a
sense.
quorum.
Yeah.
We still have a vacant position on the board for a physician, so if you know of someone who could be the physician for the board, that would be wonderful, but we could not meet until we had Nick, and once we got Nick, then we could organize, so that's why it's March instead of January.
I assume our physician representation has to live in the county.
It
Well,
does
the
not say that.
Health officer doesn't. But what about-
I think to be a member of the health board, you have to be a resident, but you don't
I
have
think they were
to.
looking for an exception to that last I heard, or
There
Andrew was. I don't know.
are no exceptions. That's per Michelle Matern, because I did discuss it with her because I was trying to convince her that Isla was perfect as our physician. Yes. Didn't work. I tried. But IDOH says and their attorney said there are no exceptions, but Andrew's the attorney, not me, so.
That does not have to be a medical doctor, as I understand. It could be dentist, chiropractor, podiatrist, so.
Veterinarian.
Psychiatrist.
Yeah.
Could be veterinarian also, yes.
Yeah.
Mhm.
Actually, Dr. Shane was on the board for a number of years, so.
Not that we need to go soliciting board members, but if someone approaches us, then that would fit that definition. They should submit their application through the county website if they're interested.
When's the next meeting? Because I thought I had them all on there at one time.
That's a Corey decision.
Looks like September to me, unless we need to adjust it for budget.
September, what's the first Thursday of the month?
It'd be September the 3rd is the first Thursday of September.
Okay, 5 o'clock.
Okay.
Who made the motion to adjourn?
I did.
Okay, Isla seconded.
She did.
Thank you.
Kelly, thank you for your service.